Criteria for selecting UV detector for pharmaceuticals analysis. This lecture is a part of analytical method development series, and in this lecture you will learn which type of detectors are used for pharmaceuticals analysis using high pressure liquid chromatography. What is criteria for using UV detector? Why UV detector is widely used in the pharmaceutical analysis? What is criteria for selecting wavelength during analytical method development? Namaste and welcome to Pharma Knowledge Forum. My name is Dr. Pramod Kumar Pandey and I provide a skill-based quality lecture on pharma analytical technique such as analytical method development, analytical method validation, impurity control strategy, chiral separation, genotoxicity, answering deficiency later. The fee for such lecture is much lower than expected. You just have to subscribe to this channel and like the video because a lot of time is spent in researching and making such lecture for you. Following detectors are used in pharmaceutical industry: ultraviolet, that is UV detector; mass spectrophotometer, that is MS detector; refractive index, that is RI detector; evaporating light scattering, that is ELS detector; fluorescence, that is FL detector; electrochemical, that is EC detector. Criteria for selecting detectors. Selection is based on chemical nature of the analytes and impurity present in the molecule. Limit of detection, that is LOD, availability of detector, and cost of the detector. Criteria for selecting UV detectors. Analyte and its related impurity must have UV absorbance. Then only UV detector can be used. Such compounds having the UV response, and hence this type of compound can easily be analyzed in UV detector using HPLC. Compounds must have double bond or triple bond in the structure. All these compounds, that is phenol, aniline, and acetone, having multiple bond in the structure and hence can be analyzed using UV detector in HPLC. Now question is, why UV detector is widely used in the pharmaceutical industries? Most of the pharmaceuticals have a UV absorbance. That is why UV detector is widely used in the pharmaceutical industries. How to choose UV wavelength? Choose a detection wavelength that has maximum absorbance or sensitivity for both analyte as well as for impurities. Suppose you are selecting the wavelength where analyte having the UV response but impurity having not UV response, then you will not get correct result. Since solvents used may cause slight shift in UV maxima and hence therefore check the absorbance of analyte in the mobile phase. Since each solvent has its own UV cutoff, and hence keep in mind while selecting the wavelength during method development, keep the wavelength more than UV cutoff. For example, if your mobile phase contains methanol as a solvent, then you have to keep wavelength more than 210 nanometer. Similarly, if you are using acetic acid in the mobile phase, in that case you have to keep wavelength more than 260 nanometer. Similarly, if you are using ethyl acetate in the mobile phase, you have to keep wavelength more than 255 nano. Mobile phase solvent have UV cutoff points. Operating below cutoff point will reduce sensitivity, increase baseline noise. That is all about this session. Hope you have understood this session. Make sure you subscribe and like this lecture. Write your question related to this session in the comment section and I will answer it on priority basis. Thank you.